if we think of, if we are not aware of tiebreaker criteria, the part A seems much more important because that is part medical subjects, basic subjects, and we want to score best there to get a better rank. Good evening everybody, Dr. Aman here from Dentacme Chandigarh, and this video is basically continuation of tiebreaker criteria, the video which we made before and explained properly what that criteria is for NEET MDS exam. And but to take, and if you want to, of course, if you want to see that video, that is available on YouTube with the name of NEET MDS Tiebreaker Criteria by Dentacme. In continuation to that, from that criteria we understood, I'm sure majority of the ones who have already listened that video now know what they really need to do with their NEET MDS exam, right? Which part to be attempted first. This is very commonly asked question. Many students ask this question, sir, which part shall we attempt first, part A or part B? Because they both have their advantages and disadvantages. But if we think of, if we are not aware of tiebreaker criteria, the part A seems much more important because that is part medical subjects, basic subjects, and we want to score best there to get a better rank. That is what is the normal thought process. But on contrary to it, if we follow the tiebreaker criteria, then part B becomes much more important to get a better rank. Okay, so just to explain this, if you remember, if you have listened that video, and you'll know that the first criteria is the students who got less negatives, overall less negatives in NEET MDS exam, right? So with that criteria, both part A, part B is equally important. That is okay. Then comes criteria 2 and criteria 3. Okay, so that is where actual difference is happening. The criteria 2 says that you need to have lesser negatives in part B, right? So lesser negatives in part B means your part B has to be strong, confident. So how is that going to happen? By when you are focusing directly on part B. Usually what happens when students start with part A, and part A is very thorough, very extensive and exhaustive part, right? Majority of your time in your NEET MDS exam will go into part A, because that is medical subjects, needs a lot of thinking, and your mind exercise will be happening there. So by the time you reach part B, thinking it is dental subjects will be able to manage, your mind is almost kind of in exhaustive state, and you are not fully attentive, and somehow because of that can be one of the reasons how silly mistakes or the negatives which usually should not have happened, they happen in part B. Okay, so that is why it is advisable to start with part B directly. And in fact, coming to third criteria, which says you should be scoring more in part B, right? So if two students having same marks, the one who has higher marks in part B will be placed at a better merit, right? So then again part B becomes very important, and hence if you're starting directly with part B with fresh mind, and because it is a dental part, with more confidence, your negatives will be less and you'll be scoring more, and hence you will be ahead of many on same marks. So that is an advice, right? So I'm quite sure that this is going to be very helpful, right? So if you have any view contrary to it, it is okay, absolutely okay, whatever suits you. But in general, that is what we feel, that part B is a better part to start with in your NEET MDS exam. Okay, and there are many other strategies. How do you attempt an exam? What is 40-60 rule? There are a lot of things which actually matter in exam, that also is important for your strategy, right? So for that you can talk to your mentors, and best wishes everybody. I hope this video is going to help you. At least you are sorted with where to start your NEET MDS exam. Okay, so take care everybody, and bestest wishes.